in past years, we actually reflected what we don't want to reflect in taking care of people. We reflected our silos. Each school had a day. We were sending the wrong message. We have in these United States a growing population with chronic diseases. They don't need simply a diagnosis and the proper prescription. Wrapped around everything that they go through are the social determinants of health. If they have a child with lead poisoning, I and the nurses and the pharmacists know what to do about getting the lead out. But that kid should only need us once. The rest of the job is for a lawyer to make the landlord comply with the law, et cetera, et cetera. So that's why this movement toward team-based healthcare.
So who's social work here? Law? Pharmacy? Medical school? Yay! Okay. I think what Dr. Piran points out is it's a team sport in healthcare. I mean, where I work, there's always a lot of every kind of clinician around. All of you are represented, and I can't do my job without you, and you can't do your job without me. And I think the other thing that got me into politics years ago, because I didn't grow up, I want to be in politics, but it was so much of I see in the emergency room was social issues. And so many social issues drive healthcare.
On behalf of Delegates Mosby and Conway and I, please join me in welcoming to Annapolis today Dr. Jay Perman, President of the University of Maryland, Baltimore, and a number of talented students from the Interprofessional Education Program. Today, colleagues, they will be here meeting with many of you to discuss issues related to interprofessional education and the future of healthcare. Please welcome them with a round of applause.
Please, everybody here. Couch if we get too many.
These students who are preparing for various professions need to appreciate the power of a group working together as a team.
Okay.
So this is the evidence of a team.
So we're designing a project right now to try and make like an interdisciplinary team that can come all at once to each patient who's at the health fair to try and streamline. I think it's just a good example of how if you have everybody in a pre-assembled team that is, their goal is to work together, it'll make patient care just a lot quicker, more efficient, and then more thorough.
Do you have a a component on the team that just talks about it or works with healthy living? I mean, the obesity in this country is just crazy. You know, we have several schools in our county now that have gardens and grow a lot of the vegetables that they use. Downside of that is I taught at a school for 6 years and I had green beans for lunch every day. I can't eat green beans anymore. I get so tired of them.
Well, we've got a proposal into DHMH. We've got people who are poor and who have diabetes or asthma, and because they don't have the availability of a team-based approach, they wind up in the ER, and then they wind up being admitted. What we hope to do, and I'd welcome your advice at some point as to how this gets shaped into a bill if people subscribe to it, is probably do a pilot program. Let's say in an area like Capitol Heights, Prince George's County, or it could be anywhere. You've got people who are underserved, I know, in Montgomery County. You take a couple of conditions in a local area, asthma, diabetes, and you organize this kind of care for them, and you measure the efficacy. Does it result in reduced hospital admissions, as some evidence would suggest? Reduced ER visits?
Right.
Does it result in a better outcome? And does it cost less, actually?
As a pharmacy student, I look at it a lot more with the medications and what we can help with that way, but then you have the social work come in and say, well, they can't get their medications because of this, and you have the med student come in and give their input.
So if they're working together with the social worker or with the pharmacist who knows more about medications, then it will be easy to teach the patients about the education part, and then a lot of the things that you're talking about will not be repeated. So that would help a lot to work in an interdisciplinary collaborative way in order to reduce the time and work more efficiently.
Give me a couple of the main points that you would want me to take back to a senator
Okay.
for her to look at. And let me ask you a question. I've got this wonderful information here.
Yes.
Next year, are you looking for some type of legislation or some type of sponsorship of some type
Yes,
of initiative?
exactly.
Okay, and this would be, so we're looking at something probably for 2018.
Right here is pretty much what we're looking forward
Okay,
to.
all right.
And this
then.
is just a pilot program. There's been a Care First model that's been very popular and very successful, and this is our version of making it more available to underserved communities.
So we're just here today to talk to you a little bit about potentially getting some new pilot projects started as it pertains to team-based care in the state of Maryland, and hopefully garner your support on those types of initiatives.
I shadow at UMB Peds Midtown, which is where Maryland General used to be. And we see a lot of kids, for example, with asthma. And you'll be looking at somebody's chart and they'll have admissions, ER admissions for their chronic asthma, 3 times over the past 2 years. And those are preventable things, but they're not necessarily something that as a physician you can prevent. You can give somebody the tools and the knowledge to do it, but if there's social factors going on, that's when you're going to need to pull in social work or law or nursing.
Well, I have Hep B and Medicaid gives me free medication, but because I'm homeless, I don't have an address, so I can't have my medication shipped to me, and they won't give me a month's supply or whatever, so I have to somehow get to this a doctor to give me the drugs, or a pharmacist, so there's just so many people involved.
All the schools have clinical programs, and we've all noticed that, for instance, in my case, in my clinics, I'll have a client who has a legal issue and I'll find that they'll have a medical issue too, or a social issue, and I'll need the help of students at the other schools, from like the school of social work. And I've been seeing that every day. And coming here today, I see that, we're all here to work together as a team, and I'd definitely come to more of these events.
It's really important for students to participate in interprofessional education, both in the classroom and at events such as this here in Annapolis. In the classroom, we're expecting our students to graduate and be able to practice in a team-based care model. And in order to be able to do that, they need certain skills that they need to learn while they're in school. So we teach to those skills in the classroom, both through elective classes, special events on campus, clinical opportunities, such as the President's Clinic in Baltimore. But not only that, in learning those competencies and skills, we want them to be advocates for team-based care as well. So coming to Annapolis today, students were able to speak with their designees in order to be able to increase the awareness on the importance of team-based care and get them really energized about the topic as well, so that when they graduate, they're really ready to be able to practice in that model.